Welcome to Stomadent Learning Division. Today we're going to talk about denture over implants and different options. Scenario number one is a fixed or screw retain all-on-4 or all-on-6 restoration. We're going to talk about the advantages and disadvantages of this type of a restoration. The advantage of a screw retain restoration is that it's permanently retained in your mouth and screwed in that you cannot remove it. Some patients find this is extremely important for them to accomplish the normal lifestyle that they like to have. So another advantage of this type of a restoration is that it can be less bulky or smaller than a regular dentures. But of course, there's also some disadvantages to that hybrid all-on-4 denture. Some offices called me and asked me, is there an alternative for that type of restoration? And why they're looking for alternative is that the disadvantage number one, that it's highly expensive. Disadvantage number two is that there is a lot of hygiene issues. Because it's a fixed restoration, you cannot remove it from your mouth. But usually there is a gap between the prosthesis and your tissue. And you have to have a good hand ability to clean between that space. Otherwise the food can accumulate and you'll have some irritation. The third disadvantage is that it can break. And the reason it breaks is because it's retained over the implants and it's completely non-removable. Your teeth embedded into your gums and held by the ligaments. And ligaments serve like a shock absorbent mechanism. So when you chew, there is a small movement in that, and therefore that shock absorbent mechanism takes away some of those forces that can break your tooth. When you restore restoration, a fixed restoration on implants, of course it's like a brick building build, and when there is an earthquake, during the lot of shocks, it can break. Same thing with that restoration. But when it breaks, it's extremely hard to repair and very time consuming. Or if one of your implant fails, it means that the whole restoration is failed. The fourth disadvantage is that there's some aesthetic issues. Or if you have a high smile lip and you have a big smile, which is really good. But in some patients, you can see that transition line between where the fixed restoration ends and your tissue starts. And that gap becomes very visible and very aesthetically unpleasant. And like I said, one of the big disadvantages is that it can be very expensive to do some kind of repair or relying to that restoration. The alternative for that type of a restoration is the removable bridge restoration. And removable bridge restoration, it made in a similar way as a fixed or screw retain restoration. But instead of permanently fix that restoration, you do a snap-on restoration. So you will have 4 implants or 6 implants with locator abutments and snap your removable bridge in. So what are the advantages of that type of a restoration? The advantage number 1, it's a cost. It can cost you 3 times less than the fixed restoration, even though it's made from the same materials. The advantage number 2 is that it's a removable restoration. Even though some patient sees it's to be like a disadvantage, but because it's a removable, it has the shock absorber mechanism. So inside of a metal housing, there is a nylon clip. And that nylon clip, when you chew, it has slight mobility, and therefore it takes away some of those forces that happens in your mouth during the chewing, or what we call the mastication. The third advantage, it has a great aesthetics. Like I said, it's made out of same materials that fixed restoration is. But if you do have a high smile lip, you cannot see that transitional line because we can slightly overlap that acrylic over your ridge, and therefore when you smile, you don't see that transition point. The fourth advantage is that it's easily cleaned, or when it comes to hygiene, there is no issues. The fifth advantage of that restoration is that if something breaks or fails, it's much easier to fix or reline than fixed restoration. Let's talk about the disadvantages. There are not many disadvantages to this restoration. Disadvantage number 1, it is a removable restoration. Some patients find to be not acceptable that they can remove that restoration, but like I said, in many cases, it actually can be an advantage to you. The second disadvantage is that in some cases, it can be slightly more bulkier or larger than the fixed restoration because you need that tissue or ridge overlap. Therefore, it becomes a little bit more bulkier or bigger. But if you lost your teeth, your gums are receding. Actually, in my opinion, I delivered many of those dentures. In most cases, it's actually a huge advantage because you can build that lip support that patient lost while the ridge are resorbing. Well, if those 2 options are still too expensive for you, what are the least expensive option if you have problems with your dentures? In most cases, I see that upper denture fits well. So we can make a milled-based denture that have a good natural suction on upper denture. But the lower denture have no natural suction or retention. So therefore, to place maybe 2 or 4 surgical implants or place 4 or 6 non-surgical mini implants can benefit you greatly. So those are the 3 options that we suggest, but nowadays we do more of them option number 2 and number 3 where we have a removable bridges or restoration for the hygienic purpose, for easily to repair if something fails. Thank you, and I hope that this information will benefit you greatly.